Welcome back, everyone. It's 9:13. You're watching CT Style. So understanding heart disease in women, how it's different, and what are the risks?
It's a very important topic, and we have an expert here live in studio. Joining us this morning is Mark Whalen. He is the physician's assistant in cardiology at HeartCare Associates of Connecticut. Good morning, Mark, and welcome here to CT Style.
Good morning. Thanks for the opportunity to have to talk about women and cardiovascular disease. Not many people know that cardiovascular disease is the #1 killer of women. At least 1 in 3 women will die every year from cardiovascular disease, more than all the cancers combined.
Wow.
Jeez.
Are there different symptoms for women?
There are different symptoms. In general, when you develop coronary artery disease and the artery is narrowed to usually about greater than 75% and it obstructs blood flow to the heart, men usually develop typical chest pain. Where women, on the other hand, only about 40% will develop chest pain.
Wow, very interesting. What about some of the risk factors that are involved?
The main risk factors for coronary artery disease would be smoking. Smoking transiently increases your blood pressure. It lowers your HDL, which is the beneficial cholesterol, and it creates diffuse inflammation. Obesity, which will increase your cholesterol. Lack of exercise. People who exercise regularly will have a elevated HDL, which is beneficial. Hypertension, diabetes.
So it's important to exercise, eat healthy.
Start moving a little bit, right?
Get up and move a little bit. So if you have a patient that comes to you guys, you have many locations here throughout Connecticut, what do you guys recommend?
Well, we have to control their blood pressure. I think many of the risk factors you can manipulate. So if your cholesterol is elevated, you should go on a low cholesterol diet and take statins to lower the cholesterol. If you have hypertension, there's many medicines to control your blood pressure. And then exercise, and you can't do much about your family history, but if you know your parents had multiple risk factors, then you have to work harder on those.
Probably be a little proactive,
Yes,
right?
very important.
And also, do you treat men and women differently once a woman is diagnosed with heart disease?
You have to be sort of a detective when women have heart disease, so their symptoms may be more subtle. So they may not typically get chest pain. They may be get pain in their jaw, shortness of breath, epigastric pain, pain in their arms, nausea. A main symptom of women with heart disease is they become extremely fatigued from doing activities that they normally wouldn't feel that.
All right, so you have to be aware about those.
No doubt about it. Very interesting facts. We weren't aware of some of these, so thank you so much for sharing all this information, Mark. And HeartCare Associates, again, many locations throughout the great state of Connecticut. Thanks, Mark.
Thank you.